This last month, the American Heart Association made a formal announcement that through the generosity of the Helmsley Foundation and also a very sizable grant from the First Interstate Bank and from the Wyoming Communities Foundation, we are initiating in Wyoming a Mission Lifeline program. Now that's an American Heart Association program that really is centered around several key tenets, one of which is public education. So we will have an increased public education campaign in terms of the signs and symptoms of heart attacks and the importance of calling 911 early. Second, we talked a little bit ago about having EKGs in ambulances. This grant is large enough that we are going to equip every single ambulance in the state of Wyoming with this EKG capability, with transmission capability. That includes Guernsey, that includes Worland, that includes Cody. We're even putting them in the ambulances at Yellowstone National Park to benefit our visitors to our state, so that their clinical information can be transmitted to a receiving facility very, very rapidly. We're paying for that equipment. We're paying for training to operate that equipment. There will be some professional education that goes along with that. And then another big part of this is we're working very closely with our critical access hospitals and our support hospitals and receiving cardiac intervention hospitals where we can do definitive angioplasty or stent care. We do believe, time is muscle, like I said before, but that as soon as you can get to a tertiary facility where they have a cath lab and get to stents and angioplasty, is in the patient's best advantage. Currently, that's limited in Wyoming to Cheyenne, Casper, and Sheridan. So we're trying to rebuild a referral network specifically for heart attack patients and standardize the care at all the different facilities so that the patient will get the same treatment in a streamlined fashion no matter where they are within the state.